Hi everyone, it's me Jen from I'm Just Like You, and since it is back to school season, I felt like this video would be very appropriate. Not only if you're not interested in pharmacy, it might just help you be motivated and inspire you to try harder. I hope that this video is going to answer many questions that you guys already have about pharmacy. I've had many people ask me not only in the comments as well as on Facebook, on emails about the pharmacy profession, especially since I have been mentioning I am in pharmacy school. So I am a fourth year in pharmacy school and I'm going to be graduating this May, so the class of 2015. Woot woot! I'm very excited to graduate, and I hope that now that I have had more experience with pharmacy school and going through the process of application and everything, that I can give you a little bit more of an insight what pharmacy is, as well as just giving you some advice on what I've done right and what I've done wrong. A pharmacist does a lot of things, but the main thing that we do is we are the drug experts. So we take 4 years of pharmacy school, which is going to consist of a lot of therapeutics and pharmacokinetics of how the body works with certain drugs and which drug is going to be best for different disease states. So we are the person that's going to help check and balance the physicians as well as other healthcare providers. So basically, if a doctor wants to prescribe a certain medication, they're very great at diagnosing, but for therapy-wise, they want to find the perfect drug and dosage that is going to be best for that certain patient. Now, everyone is different. We come in all different races, height, weight, different genetics. So each drug works differently on everyone. So not everyone's taking one drug, so there's different interactions and everything. And so our job as a pharmacist is to make sure the safety of the patient is first, as well as therapy to be optimal, and make sure that you guys get healthy. So we're not just those people behind the counter counting pills, but we're there to help physicians make the best choice, and we work all as a team to help our patients be healthy and feel better overall. We also do vaccinations, and we are the only healthcare provider where you can actually come and talk to us and ask questions about your drugs, about your medication, about anything you would like, and it's free. You don't have to make an appointment with us. You can come into either any of your drugstores, Walgreens, CVS, Walmart, Target, and we are there for you. So you don't have to pay a copay. You don't have to, it's just the only healthcare provider that is just in the neighborhood, ready to answer your questions. So that, in a sense, is kind of what a pharmacist does. Now, a pharmacist does not limit you to just going into retail where you're working at the drugstore, but you can also spread into compounding, which are pharmacists that actually specifically compound certain types of medications for specific patients. So kind of like if a toddler is going in to get their tonsils removed, a compounding pharmacist can actually put the medication, the numbing medication, into a lollipop form. You can also make it specific, such as if a certain patient can't swallow their pills, we can actually make it into a suppository, or we can put it into different types of forms so that it's easier for the patient to take. Now, besides a compounding pharmacist and a retailing pharmacist, you have nuclear, you have clinical, which are pharmacists that are in the hospital or in clinics where they are actually working up patients, either going on rounds with the doctors or just seeing patients individually, specializing in either like diabetes, hypertension, just helping out with specific patients to better their needs. That is just some of the fields. There's hundreds of different fields you can go into as a pharmacist, but I'm not going to go into it too much. So for me particularly, I wanted to be in the health field. I really like being able to help others, and I really like, whenever my grandparents were sick, I was a caregiver, and I really got to see all of the behind the scenes of what doctors and nurses and pharmacists as well as surgeons and everybody, just what they put into it. And I felt like, wow, that's something I would want to do. But to be honest, I wanted to be a pharmacist because I wanted to be in the health field, but I did not want to touch anybody. I get really attached as well. I'm very sensitive. Being in the hospital for my rotation, sometimes I would cry seeing patients, in pain and dying, and I just could not see myself in the health field and being too attached to my patients. Now, in the retail or clinical setting of a pharmacist, I feel like you're there to better their therapy and everything, but you're not so attached in some sense, and you're not touching. You're talking, trying to find out what the patient needs and what's best for them, rather than touching wounds and fixing bones and stuff like that. So basically, pharmacy is a 6 to 8 year program. So first of all, the pharmacy school essence of it, you're getting your doctorate, so it is a 4-year program. Some schools do a 3-year program, but the 3-year program is very intense. There isn't any breaks. You're not getting your Christmas, your summer break really. So I feel like that's so intense. I feel like you can't really retain a lot of the information because you're going so fast paced like this. So I did the 4-year program, and before going into the 4-year program, you have to finish your prerequisites. Prerequisites are classes that are required for you to take prior to even applying to pharmacy school. So the prerequisites for each school is different. So I do advise you guys to make sure you find out what prerequisites are required for the certain pharmacy schools that you would like to apply to. Most of the classes do overlap. So I mean, most of the schools are going to require calculus, physics, biology, anatomy, physiology, microbiology, general chemistry, organic chemistries, and so on. But there are going to be some schools that's going to require maybe physics 1 and 2, and some won't. Some might want you to take philosophy, humanity. So you really want to make sure you get the right requirements for the certain schools that you would like to apply. What I did learn from my application is that once you apply, you don't have to have all the prerequisites finished. You can still have a few that are still in the process, as long as you can finish all the prerequisites by the time that you enter that pharmacy school. So once you apply, you can have maybe, let's say, 2 classes you haven't finished, but you're working on it throughout that year that you're applying or through that summer. And as long as once they accept you, you can finish those 2 classes, you're good to go. Of course, GPA is really crucial for pharmacy because it's very competitive, and they want to see that you are capable of getting into pharmacy school but finishing pharmacy school. So those prerequisites that they require is basically for them to see if you are capable of finishing pharmacy school, if you have that dedication, that motivation. So if you make a C or D, that's really okay. I mean, there are times where you might not understand a professor or you're having some troubles at home. It's really understandable. And sometimes it might just be the fact that you don't like the subject or you're not grasping the subject very well. So if you do make a C or a D, what happens is some school actually replaces when you retake the class. So if you made a C and you retake it and you make an A, they're going to only consider your A, which is really great. But most of the school, it's actually not going to do that. They're actually going to average it. So if you made a C and now you're making an A, they're going to average it and you're gonna get a B. So basically, what I would do is try to not repeat any classes if you can, but if you do, try to make an A. And that is what I had to do for my organic chemistry. It was pretty difficult, but I mean, you can do it once you really put your mind to it. So the PCAT is basically a standardized admissions test to get into pharmacy school. So you need it for your application. And basically it's very different from the SAT and the ACT or any other standardized tests. You don't get a calculator for the math section. Yeah, you don't get a calculator. There's different types of subjects. There's a reading, a verbal, a writing section, as well as chemistry, biology, and math. I think that's most of the subjects, if I can remember. It's timed. For every wrong question you get wrong, it's wrong. Like instead of like an SAT where you actually can skip it and you just won't get any points, this is actually, you get it wrong. It's not a 0 to 100 type of grading system. It is a percentile though. So basically, it depends on the people that took the same tests as you on the same day. So throughout the whole entire US, you're taking the PCAT with the same people. There's about 6 different dates, I believe, and they're designated. You can't pick your own date, really. So let's say for October, you're taking a test. Everyone that took that test on that October date, they're gonna compare your scores and see which percentile you're in. So basically, it depends on how well you do. So let's say you do really bad, but everyone in the October group did really bad. That means you could probably be in the higher percentile. So it's kind of confusing. For me, I did do the Kaplan course and I did not like it. It really depends on the type of instructor you're gonna get, so that's kind of a luck. So I felt like my instructor was horrible. I didn't really learn much. I ended up doing Dr. Collin's PCAT, and I'll put the link in the info box where you can actually find it. And he had a lot of practice problems, and overall I just continued to do those practice problems and just continue to just repeat and get really familiar and get really fast and try to find like my way of taking it. And I think that's really what helped me. And of course, I didn't take my PCAT only once. I took it like 3 times. It was just a really difficult type of test because it's so different from what you're used to. You're used to finding the correct answer, which is like for a math problem, you try to, do everything step by step by step. But with this, your time, you don't have a calculator, but you do have multiple choice. So what you do is you try to strategize and find the correct answer with seeing that, one of these multiple choice is my answer. So you try to kind of manipulate the numbers around a little bit to try to find that correct answer, if that makes sense. So basically, you're trying to impress them on paper. You can't see them, you can't give them a smile and give a good impression. So all they see is numbers and your application. So basically, what I suggest is having a lot of experience, not only in retail, maybe getting your technician license, being certified, or just having leadership experience, maybe being in healthcare type of organizations where you are a leader, an officer, and just going through different projects and events and everything, you learn more. You learn and you are more experienced with dealing with people, and you'll have stories to tell. The most important organization for you to be a part of is the Pre-Pharmacy Association at your school right now. Basically, they're going to help you not only with mock interviews, but just the process, reminding you when the deadlines are for certain schools, application, PCAT, and it's just a great community for you to learn from. Not only that, but you get great recommendations. So a part of the application, you're going to need people to recommend you that would say to the school, hey, I recommend this student or this person to you because blah, 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 blah. So if you are exposed to leadership skills and being out there and getting your name out there and getting your hands wet and dirty with different projects and everything, then a lot more people will get to know you, and that way they can say, wow, this person's very dedicated, this person's always on time, this person really likes the pharmacy profession, this person is really great at public speaking. Everyone is different, and if you're just going out there and learning new things, the person that's writing your recommendation letter can speak more highly of you. My advice to you is that there's this many people applying for pharmacy school this year, okay? Out of this many people, probably only this many people are going to actually apply correctly. So meaning they finish their prerequisites, they do get their recommendation letters, they get their shots, write their personal statement, get a good PCAT score, everything, have everything in time. This many people are going to do it correctly, and these many people are not. And that's how they weed out those people that they do not even look at their application because they didn't meet all the requirements. You don't want to be a part of any of these people. Now, you want to be a part of these people. So basically, it's really important to follow the instructions of applying as well as getting everything in on time and getting it in prior to the deadline so that just in case there's any mistakes. You don't want to not get into pharmacy school due to your mistakes rather than your ability. Once they like what they see on paper, they will want to see you in person. So basically, the next step is the interview process. going back to what I said earlier with experience, it really will help your interview. Usually in interview questions, they're trying to see how you work on the spot, how you work under pressure, and wanting just to get to know you. So some interviews are going to be open file. So they might see your grades and they might ask you, okay, what happened here? I did see that you did improve in this part, but what happened for you to get a C or a D in this class? Or they might say, oh, you did really well in this class. How'd you do that? Most of the interviews are going to be closed file, where they're going to not talk about anything that's on your application, but just talking about just talking to you face to face. Well, with your experience, it's really going to help because they're going to ask you questions about, when was the last time you showed leadership? Tell me about a time that you made a mistake and you had to correct it. What would you do if you saw a fellow classmate cheat? What would you do if you didn't understand your professor? They would give you a lot of situation, scenario type of questions, and it really helps once you've had the experience in the pharmacy field or in different organizations that is healthcare related. You're going to have the exposure for you to retell those types of stories. And also practice. Go on to student doc forum, and you can actually go under your specific school that you're applying to, and there's so many people on there. They will share with you their experience at the interview, and it will really help you. I'll put the link in the info box once again, and I find that just being prepared and being yourself really helps. If you do not get into pharmacy school after your first try, I feel like you still should try again. You already went through the prerequisites, the PCAT. There was so much you have already put into it, and if you didn't get in, it's okay. I mean, out of like 1,000 applications, they only see an interview of maybe 400, and after that, they only accept 100. So, first of all, I would say, did you follow the application correctly? If you did, good. If you didn't, see what you did wrong and correct it. Next, what I would do is email that school and say, can you please look at my application and please let me know how can I improve or how can I impress you better the next time? Is it my grades? Is it my PCAT score? Is it my personal statement? Anything. You ask and you ask, because there are people out there that are going to answer you and really help you out, and you need to just fix those things. Everyone, it's your first time applying to pharmacy school or your second time. You learn from the mistakes, you learn from why you didn't get in, and you try again. If you feel like this profession is for you, definitely try harder, stay motivated, and it's okay. In my pharmacy school, there are so many people that are older than me and younger than me. We come in all different sizes and ages, and it's because some people might have already done a profession and they're like, you know what, I feel like pharmacy is for me, and they go back to school and they do this. Or there are people out there that they've tried so many times going into pharmacy school, but they didn't give up. So that is my advice to you, is don't give up if you truly find that pharmacy is for you. Instead of just going in local pharmacy schools, you have to branch out there and go and try to sacrifice a little bit and go out into different states. I encourage you guys to continue to try even if you don't get in. To be honest, I think the hardest part was getting into pharmacy school, and once you're in it, you kind of just pick up the pace and you see how hard everyone else worked to get into it. We all work really hard together to get out of pharmacy school. I find that it's a little challenging. Everything is a lot more fast-paced, but it's doable. I feel like if there are thousands of pharmacists out there, that means they did it, then we can do it. But you just have to think of the finish line. So to me, I felt like pharmacy school is great. I met so many great long-term friends that I will want to be friends with for the rest of my life. I felt like pharmacy school has taught me a lot. I've grown a lot, and I have more appreciation for life as well as for people, for others. And I just really think that the healthcare profession really made me a more heartwarming person overall. So I would say pharmacy school pretty much did me well. I mean, I got a couple of more gray hairs, but overall I felt like I learned a lot, and I would probably not do it over again, but I'm glad I did go to pharmacy school. I would say yes, I would. I do like being in the profession. I feel like we do make a difference every day to patients, either if it's really little to really large. I find that the best part of being a pharmacist sometimes is just being so accessible to the patients. I find that whenever I am at the pharmacy, someone that could not have that much money and they want to ask, a 7-month-old baby can take a certain medication, they're afraid because they can't read. You know, it's a pharmacist's job to be able to help them without the obligation of insurance, the obligation of appointments and all of that. I feel like in the end, we're so close to the community that we can help. And I feel like if you're a people person, if you're a type of person that would like to do something like that and be able to help others in the sense of more education in therapy, more education in the dosing of different medications and stuff, and helping people in that way, I think the pharmacy profession is something I would recommend. I did mention before that I wanted to be in dentistry instead, but I felt like with dentistry I did have to touch and I might create pain on people and everything. So in the end, I feel like now that I've gone through a lot of my rotations, I do find that pharmacy is the career that I would have picked if I had to pick all over again as a healthcare provider. That is my take on answering all the pharmacy questions. I hope that I answered most of it and that my advice was helpful. Of course, there are millions of other questions that I probably didn't think of or didn't see. So if you have any specific questions, please let me know and I will try to answer you. I try my hardest because I do feel like when I was applying for pharmacy school, I didn't have that many people to ask, and I wish I would have someone that would be willing to just kind of tell me everything. I am very open to answer any question. So I hope you guys enjoyed that, and good luck on going back to school, and I hope that this video inspired you as well as motivate you to try harder this year, and I hope that you will apply and you will succeed. Alright you guys, I'll see you in my next video.